Thank you all. Let's go ahead and get started. Thank you for coming today. Welcome to the Crane Policy Chat. This is an event series hosted by the Crane Center for Early Childhood Research and Policy. If I'm craning like this, it's just to get to my mic. Raise your hand if you have a hard time hearing me, if I straighten out my head. Can you still hear me? Okay. So the purpose of this event series is to discuss current policy issues that affect young children with an expert guest, today Dr. Lauren Jones, and an engaged audience, which is you all. So that is your cue to please be engaged today and ask lots of great questions. We're excited today to be talking about state and federal policy tools to improve the well-being of children and families. We'll be talking about the social safety net, specific policy programs and levers, including childcare, and even a little bit about Canada, the country. So for the first 40 minutes or so, we'll have a guided conversation, and then we'll have ample time at the end to ask questions, at least 15 or 20 minutes. And before I get started, I also want to thank the John Glenn School for co-hosting this event and giving us the space, for Kathy Kupsky for sorting out all these details that allow us to get together and have a great event. There's a lot that goes in behind the scenes, and also to Annabelle from John Glenn. So without further ado, I will introduce our expert guest today, Dr. Lauren Jones. Dr. Jones is an associate professor in the John Glenn College of Public Affairs and a faculty associate with us at the Crane Center. She conducts quantitative research in social policy, early childhood education, health, and consumer protection. Her work spans several topical areas, including family tax credits, children's mental health, traffic safety and drunk driving, and more recently, childcare. She has published work in academic journals such as the Journal of Human Resources, Health Economics, and the American Journal of Health Economics, and her studies have won Best Paper Awards in the Journal of Policy Analysis and Management and the Canadian Journal of Economics. She also works with states and provinces on applied research projects on universal basic income and childcare policy. She aims to inform the development of governmental policies that improve the material conditions and safety of children and families. Please join me in welcoming Dr. Jones.
Thank you.
All right, so your research centers on child and family well-being. Can you tell us what drew you to this area of work?
Sure. Well, I've always been interested in trying to, help people. I was trained as an economist, and there's kind of two ways you can go when you're trained as an economist. You can either go and make money, which I was like, no, that's not for me, or you can use your skills to conduct policy research and kind of understand the way families make financial decisions and how the government can make decisions and implement policies that make it easier for families to flourish. And so that was the route I chose. So I started out working in tax policy for the most part, and with a focus on family and child tax credits. And then, working away, kind of, coasting along, and then all of a sudden I had my own baby, and she started in childcare, and I was just kind of struck by what a fascinating and integral part of our society childcare is, and how kind of under-researched it is, especially in the economics and policy space. So for the past 4 years or so, I've been focusing more on early childhood education and childcare policy in particular.
Great, thank you. Okay, we're going to start with 2 poll questions. We have the first one here. What is the child poverty rate in the US and in Ohio, respectively? So there's 2 numbers here. Take a look. We'll do a live voting, if that doesn't put you too much on the spot. On Zoom, we normally just click it in, but we'll do a raise of hands on this one. So is it 10% and 24%, 14 and 12, 16 and 18% respectively, or 20 and 25? All right, anyone who thinks it's A, raise your hand. Yes. Now I'm like worried, I gotta check my numbers. B, who thinks it's B? Don't be shy. C? And D. All right, about evenly split between C and D. Those who answered C, you are correct. That figure is 16% in the US and it's 18% in Ohio. We tend to rank around the national average. Those of you that answered D, I think there are numbers that sort of go above the federal poverty line, and it's shocking to see how many kids fall into that. But the actual federal poverty line, which the government sets based on family size, is quite low. I'm often shocked when I go and look at the numbers again. For a one-person household, poverty is $15,060. And for a family of four, that's just over $31,000 for a family of four. So good job on that one. Let's see if you can get this one. So this question, how many people in the United States used at least one social program? And I pulled this number from HHS. The programs that it considers include the Earned Income Tax Credit, Supplemental Security Income, Temporary Assistance for Needy Families, basically all of the acronyms. I'm going to try to stay away from acronyms today. Publicly funded childcare, children's health insurance, supplemental nutrition assistance, etc. So this was for, I think, the year 2019, but the report came out in 2023. How many Americans? Do we think A, 20 million? Raise of hands if you think that's it. B, 55 million. C, 68 million. Or D, 99 million. Man, you all are good. The answer is 99 million, which is a lot. Like you're the economist, you're the math person.
Third plus or minus.
Yeah, a third of Americans that year used at least one of those programs. All right, so let's talk about the social safety net. These are programs that are providing supports to people during times of economic hardship, and I just listed several, and we'll talk more in depth about some of those in a moment, but I want to start by asking you, Dr. Jones, what does a strong social safety net for children in the United States look like, or what should it look like? What does it do? What does it accomplish if it's working well?
That's a great question. Thanks, Jamie. I think, one way I like to think about social safety net and the way economists often think about it is thinking about it whether kind of on the one hand, we're using these programs as insurance programs, so insuring against some kind of unforeseen drop in earnings, maybe a job loss, loss of insurance, health insurance, inability to pay for childcare or housing. So thinking about these programs as insurance on the one hand, versus on the other hand, thinking about them as investment and redistribution on the other hand. So the big difference between those two ways of looking at it, I think, is that the insurance approach or the insurance view on the safety net is really viewing the programs as being something families are going to access rarely and only if something goes wrong. On the other hand, if we think about these programs in terms of investments and means of redistributing resources in society, these are not going to be programs that we think about families using only in times of need or when something's gone really wrong and there's nothing else left available. In some ways, I kind of even hate the term social safety net because I think it really implies that first perspective on it, that these are only tools that families can access in a case where something's really gone wrong. My preferred way of thinking about it, and I think one, the way that a lot of other kind of rich countries think about these programs is thinking about these programs in terms of investments. They're programs that every family is going to access. So much more similar to the way we treat public education in this country, right? We don't think about public education as a service that families access only if something goes wrong. We think about it as a way to invest in families and to level the playing field to some extent for families. A lot of these other programs that we tend to kind of group into the insurance side of the world, I think we could really, do well if we shifted our approach and shifted our thinking, moving them into the investment and redistribution side of the world. So thinking about, for example, childcare policy, the federal funding we have available for childcare policy, it's not just something that families are going to access in case that something's gone really wrong and they can't afford to pay for it themselves. No, this is a program where we are spending money now to invest in children and families, children and their families, their mothers, in particular, in order to have long-term returns, in order for us to kind of have growth and support families and children as they become productive members of society. So I think very broadly in the US, that's a shift that I wish we could really kind of make happen here, moving away from this insurance way of thinking of these programs and into thinking of them more as investments we're making in families and kids for the long term.
Mhm. Thank you. Yes, social safety net is such a loaded term. I was like researching what it technically meant because I know it has so many connotations. And that figure there, that a third of Americans use it, even surprised me. It's a much wider net, I think, than we think about.
Yeah.
Okay, so we know that these social programs are costly. At least we often hear about how much they cost. Here's an example from last year. Ohio's been talking about whether or not we can provide free lunches for everyone, how much federal dollars are available to that. And the headline was, Ohio will pay more for kids' meals this school year. And they calculated out the exact amount it would cost Ohio by reducing like 40 cents for families. And so those calculations I feel like are always out there. We're always talking about cost. Why do you think that is, especially compared to talking about the benefits of those investments? Why are we always talking about cost?
Well, I think there's two reasons that I can think of right off the bat. One is kind of political, and the other is technical. So I'll start with the technical. I mean, if we're trying to understand how much it costs, for example, to provide every child with lunch in Ohio, that's a relatively simple calculation to do, right? We can figure out, okay, who's going to be providing the lunch? How much are they going to charge us per box? Oh, my baby is here. My baby and my husband are here. Yay.
Oh,
Hi. Sorry. What was I saying?
Calculating if we were to
Yeah,
give free
right.
lunch to everyone,
Right,
the technical
so
side of it.
It's a relatively easy calculation to do, right? We can add up how many children do we have, how much is it going to cost per child per day to provide them with the meals, and we can add it up and we have our cost number available to us. When we're talking about the benefits, that is a much longer time horizon, firstly, for where we need to kind of add up the benefits. We also need to make a really kind of almost philosophical decision about where are we going to kind of stop counting the benefits. So of course, there's the immediate nutritional benefits that the children are going to receive, but are we also going to count the improved test scores that we see because kids are fueled up before they need to perform in school? Are we also going to count the hours in the day that parents and mothers get back because they don't need to be making lunch for their kids? And how are we valuing that? How long do the benefits of providing a child lunch today, how long does that stretch out into their future? So if it's improving their test scores today in the third grade, how long can we kind of see the return on that investment stretch out into the future? Is it going to also affect their likelihood of graduating high school, attending college, getting a good job, limit their access to other kind of safety net programs when they become adults, right? So there's a real kind of technical difficulty in counting the benefits, which is one reason why I think the costs get discussed so much more readily. I think there's also a political side to this, the fact that the person in power right now, the folks who are making these decisions about whether to make the investments in the legislature, they're the ones kind of pushing these numbers out, and they're the ones who are making the decision today about whether to spend the money. They're not the ones who are going to get the political capital from that long-term accrual of the benefits of the programs. And so from their perspective, they're really kind of making decisions on a different time horizon than what we are as a society. For them, they're making a decision on their 4 or 6 year term limit. For us, we're making decisions about our children and children that live in our neighborhoods and in our country, their children going down the line. So the time horizon is really different, and I think that creates almost a political mismatch between what we as constituents are thinking about when these decisions are being made versus what our political leaders are thinking about.
Mm-hmm. So what we need are 30-year term limits, is that what I'm hearing? That would create a whole lot of other problems.
Yes, it would.
But yes, you're absolutely right about thinking
or more
long-term.
selfless political leaders. I mean, I think it's a tough nut to crack, that one.
Mm-hmm. Okay, so in a perfect world, if we were able to talk more about the benefits of those investments in a way that's persuasive to our policymakers, how would we go about doing that? How can we quantify them? Can we quantify them? Who out there is kind of doing that work to attempt to put numbers to that, to match, so that we don't just have cost numbers, but also ones that show the benefit of these investments?
Yeah, so that's where we kind of get into the research component of this discussion. There are many researchers who commit their careers and lives really to trying to estimate the benefits of various social programs. And it's actually a difficult problem because, one thing that makes it difficult is that most of our programs are means tested, meaning they're only available to families and children with income below a certain threshold, right? What that means is that we're providing the benefit to the kids who, have the deck stacked against them to begin with. So if I want to understand what is my return on investment of providing lunch, let's say, to children from families who have income that put them below the poverty line, and I'm looking at, let's say, the test score that year. I can't simply compare the test scores of the kids who got the free lunch to those who didn't, because of the fact that the kids who got the free lunch are also the kids from families that have the most kind of stuff they're dealing with, right? They're dealing with having limited income, they're dealing with parents who may be working multiple jobs, they're dealing with all sorts of other insecurity that we know kind of concentrates among families that earn less. And so if I were to just compare the test scores of these two groups, it would always look like the program isn't doing anything, because those children are always going to have worse test scores than the kids from higher income families who don't get the program, right? So we have this kind of difficulty where we've got a mixing up of the correlation and the causation, right? Simply comparing those kids, that would provide me with the correlation between program receipt and the outcomes. That's not telling me what the value add is of this program. To get the value add, I really need to be kind of tracking children over time to try and understand how, for a given kid, when I give that family the free lunch, how does that affect the child's test scores? And that's actually a really difficult experiment to run. So, the gold standard in social science research is the randomized control trial, where I would randomly provide the free lunches to a set of children and then have a randomly selected control group that I can compare to. But there's a lot of reasons why we can't always do that in social science research. There's an ethical issue, first of all, that if we are providing a benefit, is it right to only provide it to some children? There are ways we can kind of get around that by giving the control group the benefit later on or something like that. But that's one consideration that I think is one of the first ones we need to think about as researchers. And then there's just the difficulty of running an experiment like that and the cost of tracking children over time. So it is a very difficult and expensive endeavor to run a randomized controlled trial like that. And that's where social scientists like me come in. So people trained in a variety of social sciences, but economists in particular have developed a series of methods to try and essentially mimic the results we can get from a randomized control trial by using changes in policy that are kind of happening naturally. So if Ohio, for example, were to pass this policy, we would almost have a kind of natural experiment, is what we call it, where all of a sudden there's a new cohort who has access to the free lunches. The kids from the year before didn't get access. We have this kind of almost natural experiment that's happened, and we can use that to help identify the benefits. And so that's the type of work that I do. A lot of other folks in this space, and so that's where we do start to get some estimates of the return on investment for these social programs. There's one recent study that came out in 2020 by Nathaniel Hendren and some co-authors, where they looked at I think over 140 of these policy changes where various states or federal government expanded benefits for some program, and then tried to kind of do these natural experiment analyses to understand what was the return on investment for each of these programs. And what they found was that the biggest bang for your buck, not surprisingly, when you're talking about government investment, is found in investments that we make in children. So for example, providing children with health care, expanding the CHIP program, the free healthcare for children has a huge return on investment because of the fact that being unhealthy and not having health insurance to see a doctor has such far-reaching impacts on kids for their whole life. So, you know, the research in this space, I think, is pretty far along, and that we know what the programs are that we should be investing in. I think the issue now is having our legislatures kind of catch up with where the research is.
Mm-hmm. Thank you. And thank you for diving into that like technical explanation about the study design. It's maybe not an exact parallel, but I feel like we come across that when we talk about pre-K or fade out or folks seeing a study and declaring it doesn't work. Mm-hmm. But the groups are entirely different, right? The kids that are getting state-funded pre-K versus the other group, they're not getting nothing, they're getting something, which might be really intensive learning at home with mom, mm-hmm. which of course is probably gonna look better.
Yeah, this has been a really big issue in childcare research in particular. There's just kind of a host of studies that have found that when publicly funded childcare is rolled out, when we look at outcomes, especially kind of into third grade, so like after the immediate years when the child is in childcare, looking at the long-term outcomes, a lot of studies have failed to find kind of persistent effects. And you know, I think you're absolutely right that those headlines can be really discouraging, but when we really dig into the studies and start kind of trying to parse why we may be challenged in finding the long-term effects, these issues of like the one you're discussing, what we would call technically a selection problem. Mm-hmm. So essentially the kids who are most likely to take up the universal pre-K, for example, are the kids who were already kind of getting the most intensive education at home. It's the kids who are, you know, the kind of savvy families who are find it the easiest to take advantage and kind of take up these new programs. And so we don't always find the effects we're going to find, and that's why I think it's really important that researchers, you know, really are careful in the way they're writing about their studies and really emphasize these very kind of technical issues that can take a lot of time and energy to sort through, but really, really have important policy impacts if we're not careful about how we frame them.
All right, let's change gears slightly. So you have a unique perspective, not just as a social policy researcher, but also a citizen of Canada. You're a dual citizen, right?
I'm not an American citizen.
Oh,
yeah.
Okay, citizen of Canada.
I have a green card holder.
Okay.
Yeah.
Sorry to get into that.
That's okay.
I knew you were Canadian.
No worries.
So can you talk about some examples from Canada when it comes to intentional policy design to support children and families?
Yeah, so I think there's been in the past 5 years or so some really interesting advances in Canada at the federal level. The two big ones being the expansion of the Canadian Child Benefit, which is a tax benefit that I'll talk a little bit more about in a second. And also what's being rolled out right now is $10 a day daycare for everybody. That's what it's called, daycare. We like to use the term childcare here at Crane, but in the kind of technical policy term is $10 a day care for families. So any family who is attending a participating provider can pay $10 a day for their child to receive care. And there's no income limit on kind of which families can access that. So that's kind of different than the way we subsidize childcare here in the United States. The big federal subsidy program, the Child Care Development Fund grant, federal program passed down to states who then implement it, is a means-tested program. So only families that have earnings below a certain limit can get that subsidized childcare. So the Canadian innovation is that type of program is currently being rolled out to every family in the country. So I think these are two really important policies. You know, I'll talk a little bit more about the Canada Child Benefit later in a moment, because I know you're going to ask me about tax policy, so I'll leave it for there. But talking about the $10 a day childcare program, I think it's so important that we're subsidizing care, but not just subsidizing it for the low-income families. And this really illustrates the point that I was making earlier of having a different perspective on what the social safety net is for, right? This program really is emblematic of an approach where we're treating childcare and we're treating public investment in childcare as a long-term investment. We're not treating it as an insurance program. So every family has access, every child has access. What that means is that we're not creating this kind of dual system where some families, if you're kind of a low-income family, then you can attend a provider that accepts publicly funded childcare, but there's a whole set of providers that are not going to accept those children. And what we wind up with in a system like that is essentially a segregated early childhood system. And that's, I think, that's the downside. That is the big downside of treating these programs as insurance rather than treating them as an investment that we want to make in every child that's coming through, coming into a childcare setting.
Okay, you're going to talk more on that in a moment. So best practices. Tell us what the research says about what kinds of policies are the most effective at improving the well-being of children.
Yeah, so economists talk about kind of group policies into two.
I'm sorry.
Oh, something's vibrating.
Very distracting today.
It's okay. I brought a baby. It can't be worse than that.
I think it's your phone.
So economists tend to group programs into two categories. The first is kind of cash transfer programs where we just give families money. The big ones we have in the United States, we have temporary assistance for needy families. This is what we would have historically called welfare. So this is a safety net program that is administered through states. Families need to apply for the program, and there needs very restrictive of who can access the money and how long you can get the money for, but families do just receive kind of cash. The other big ones we have in the United States are programs that are administered through the tax code, in particular the Earned Income Tax Credit and the Child Tax Credit. So these are also programs that provide families with cash in that when you file your taxes, families are essentially getting more back through these programs than what they paid in taxes, So it ends up being a cash transfer. The other types of programs we have are programs that provide what we call in-kind benefits. These are programs like health and Medicaid, healthcare programs, Medicare for older Americans, the Child Care Development Fund, subsidized child care program, housing vouchers, the SNAP food assistance program. So these are all what we call in-kind benefit programs. And so generally speaking, research shows that cash programs are better for families than in-kind benefit programs. The reason being that families are going to know better than the government what they need, right? So suppose you are trying to make the decision about whether to subsidize my family with a SNAP program, so it's like a food voucher, or just giving me the same kind of value in cash. Well, if I'm, many families would be indifferent between those two programs, more or less, because they buy their food at the grocery store. But suppose my family has a really big garden that we can kind of supplement our food from, and we spend a lot of time canning and doing those types of things. Well, in that case, the food voucher is not going to be as valuable to my family than the cash would be. Maybe I needed the cash to buy other items or to kind of pay my rent. Same thing, we can think about childcare, right? Not all families want to choose to use childcare. So, for two families with a similar income level, it's kind of theoretically better to just give them cash and let them spend it on what they need rather than forcing them to purchase specific items through voucher or kind of subsidy type programs. So generally speaking, we think from the family's perspective, the cash programs are better. However, there's a big caveat there. In industries where we need some kind of government intervention to support the supply side of the industry. What I'm talking about here is the kind of childcare crisis that we have right now in this country. So we have a situation where even if we gave families a whole bunch of cash to pay for childcare, it would probably not be enough to remedy the problems that we are seeing on the supply side among childcare providers that are essentially created from the fact that we have, you know, very, very good regulations that limit the child-teacher ratio. So by having those kind of very important regulations and rules in terms of regulating our childcare industry to support safety and development of children, we're creating a product that's essentially, you know, too expensive for most families to pay for, because of the fact that we're going to have 4 children for one childcare provider in a room. We're going to have a rule like that. That's going to really drive up the cost of care to the point that it may not be sustainable and it may not be affordable, even if we do give families a bunch of cash to kind of purchase the programs. So I generally support programs that transfer cash to families, but I do think there are industries, in particular childcare and housing right now in our country, where we need to have programs that are specifically kind of supporting the supply side of those industries. So supporting the building of new affordable housing, supporting the revenue streams of childcare providers so that the services are available for families to purchase.
Great. All right, let's talk taxes. I know that doesn't sound very
My
exciting.
favorite.
But as it turns out, tax policy is such an important poverty reduction tool. I know when they expanded it sometime during the pandemic, I forget what year, we had a historic reduction in child poverty, which has since gone back up. So can you talk a bit about the connection between tax policy and child well-being?
Yeah, so I think you know, people are often surprised to hear that in the United States, the biggest cash transfer program we now have is the Earned Income Tax Credit and even the Child Tax Credit. Now, they're both dwarf temporary assistance for needy families, or kind of what we would call, you know, would have historically called welfare. So that program is tiny now compared to these cash transfer programs that are administered through the tax code. The Earned Income Tax Credit has kind of slashed poverty, you know, historically since it was really expanded in the mid-90s. And as you rightly mentioned, when the child tax credit was expanded temporarily during the pandemic, there was a huge improvement in child poverty in particular by transferring families that cash income. So I really think these are important programs that you know, they do get a lot of attention in the research world, but also kind of, I think families and kind of the electorate are not generally aware of how important these programs are for families and for kind of addressing child poverty. One really wonderful thing about them is that because they're administered through the tax code, there is a lot less stigma associated with accessing the benefit than there would be for a program like Temporary Assistance for Needy Families, where you need to kind of submit a separate application. You need to have these demoralizing and demeaning checks on kind of who's living at home, you know, who's working. There's, you know, there's some really interesting research coming out about these the Temporary Assistance for Needy Families program. When it was first rolled out, there were these very demeaning rules called like man in the house rules, where families could only access the funds if mothers can only access the funds if a man did not live there. And we had kind of these inspectors coming to mothers, especially Black mothers in the South, who were accessing these programs and asking them about who was sleeping in their bed with them, just like horrible, horrible rules. And so one really nice thing I think about shifting these programs into the tax code is that we eliminate a lot of the kind of, you know, ability for the state to treat people badly, to kind of identify who is poor and who we are going to treat badly accordingly. So I think one nice thing is by moving some of the funding of those programs into the tax code, we are kind of moving away from that insurance approach. These are programs that you only access if you've done something really bad, or you really messed up and you don't have income. We've moved away from that towards something where we're acknowledging, like, this is a credit that you have earned. It is called the Earned Income Tax Credit. You have worked, and we're giving you a work subsidy because we understand that for the lowest paying jobs and families who are earning less, we need to be subsidizing their labor because of these kind of underlying structural issues in our economy that does not, leads us to have many jobs that don't provide a living wage. So I think that's a really nice thing about it. There are some kind of difficulties with the tax code approach to administering the programs. In particular, if you are earned below the tax filing threshold, you could be eligible for an EITC, but you may not file your taxes because we also in this country make it really difficult to file your taxes. And so if you're not filing your taxes, you're leaving money on the table. We know that 1 out of 5 EITC eligible families do not claim their credit. And so that's an ongoing issue, I think, that we're combating, and similar issue we found with the child tax credit expansion. But I think right now the expansion of the child tax credit is one of the most one of the policy proposals that leaves me feeling the most optimistic, because I think there is political will to have an expanded child tax credit be written into permanent, the permanent tax code. Versions of the expanded tax credit are kind of going through the federal legislature right now, and I think we will get something. I don't think it will be as generous as what we saw during the pandemic, when families were getting $3,600 a year for every child under 6, and the credit was made fully refundable. But I do think we are going to get parts of it, and I think that's a really positive change that I see.
That is really interesting about the stigma. That's something I hadn't heard or thought about, and even just the use of the word earned. Can we put that word in front of lots of other programs, or maybe do a rebranding? Kathy, can you rebrand all the programs? No big deal. All right, we're going to change gears one more time before audience questions. You and I have been working together on a number of state-level contracts in Wyoming, Colorado, and Ohio. So can you talk a little bit about those, as well as anything you've come across that you find especially surprising or you want to share with the group today?
Yeah, so the work we've been doing with Crane, and Jamie and I have kind of spearheaded these projects. It's been a really wonderful experience, and as she mentioned, we've been working with states on their child care policy. In particular, we've been working on projects that look at the publicly funded child care. So this is the Child Care Development Fund, federal program. It gets kind of pushed down to states, and then each state administers their program differently. In Ohio, we call that program publicly funded child care, and it provides a subsidy to low-income kids to be able to attend various child care providers. The other program or the other kind of set of regulations we've been working on is the Quality Rating Improvement System regulations and licensing regulations. So I think like two surprising things I've learned through this work. Firstly, the publicly funded child care program, the Child Care Development Fund program that we've been working on in Ohio, it's not a very big program. There's only about 1 million children across the country who receive funding through this program. The thing that really surprised me, though, was to see what a large share of childcare providers are accessing at least some of their revenue through this program. So because of the fact that kids are kind of get the subsidy and then go to a variety of providers, there's a huge share of providers, I think it's about 40% nationwide, who serve a child that is receiving Child Care Development Fund subsidy. So even though it's a small program in terms of the number of kids it served, it has kind of an outsized impact on the childcare market. That becomes especially true when we're looking at lower income communities, where upwards of 100% of childcare providers in some communities in Ohio are receiving funds through this program. And so I think this offers like a really important opportunity for states to really support their childcare industry by making smart decisions about how they administer their program. So the CCDF program, there's a lot of leeway in terms of how the state actually administers the program. How much are they going to pay providers? How much is our families going to have to pay in copay? Who's going to be eligible, et cetera? And I think states have a lot of opportunity to be able to support childcare providers by making smart decisions about the way they use those funds. And I think that can have important trickle-down effects to the kids, not just the children receiving the CCDF or publicly funded childcare subsidy, but also to all our children, because if we have a strong childcare provider market and supply, that's going to help every child. So that's one thing that I've been really kind of impressed by in this world, and really see opportunity for states. The other thing is in the QRIS systems, the quality rating improvement system. So for those of you who don't know, these are state level rules that require, ask providers to kind of meet various quality regulations, and then if they meet them, they receive some kind of rating. So here in Ohio, we have Step Up to Quality. Right now, it's a 5-star system where we, if providers meet different kind of quality benchmarks, they're able to kind of earn stars, and then they can publicize their star level. And they also, in some states, including Ohio, receive a higher subsidy rate for children who are subsidized through the publicly funded childcare program. So one thing that's really surprised me about these programs is while they provide some really important guidelines and really important recommendations for how providers can kind of produce a higher quality childcare, they also put an incredible amount of administrative burden on providers. So I don't know if we have any childcare providers in the audience today, probably not, because they are busy providing childcare. But the amount of kind of paperwork and trainings and entering information on this online portal and having it kind of transferred to this portal, having to prepare for visits, having to train folks. And so a lot of these tasks, these administrative burden tasks, are not actually improving the quality of the childcare. These are kind of, they're administrative burden. They're essentially wasted hours and wasted investment time. And so I think this is another important opportunity that states have for really looking closely at the set of regulations they're putting on providers. And, not kind of, we don't want to create a system where we're not incentivizing higher quality and we're not ensuring that we have kind of quality standards for all kids, but making sure we're doing it in a smart way that is not piling on the administrative work for what are essentially small businesses. And I think that's another really important opportunity we have for states to support the childcare market by supporting the providers and the people, primarily women, who run these businesses.
Yep. I think I'll never forget the first time I saw the mountain of paperwork that our school principal had and binders on her shelf. And I know, and we're working with Ohio right now, that they're trying to streamline some of that and moving toward. And so when you're speaking about that, I know we're talking sort of nationally. Colorado, we just had all these interviews with providers hearing about their regulations. It's kind of a national issue folks are looking at. And
yeah, absolutely. I think Ohio, very cool that they are doing this exact thing right now and trying to streamline their QRIS Step Up to Quality system to reduce the administrative burden on providers, because they're realizing more and more that every minute of administration we require a provider to do, they're either taking that away from the kids or they're taking it away from their free time after work. And neither of those situations is fair.
All right, that went fast. It's time for you all to ask questions on any of the above topics or anything else related to childhood well-being that's on your mind. We don't have a mic, so just holler it out. Tell us your name. Yeah. Tell us your name and who you're with if you want to.
I'm Louise, and I'm at the Crane Center. Just kind of going off of the topic you guys were just talking about, do you think there's a way to, instead of it being entirely linked through the publicly funded subsidies for childcare, that the QRIS could be a subsidy in itself? Like, if you do this administrative work, your center will get this subsidy just for your center that is great quality. That's possible.
Good question. So the question was, is there a way that, I mean, I'll rephrase it a little bit, that states can incentivize participation in QRIS and moving up QRIS by rating by improving quality through some other kind of policy tool besides the publicly funded childcare? Because, you know, the primary way that states kind of pay providers for doing this work is by providing a higher subsidy rate for subsidized children. And so what ends up happening in that situation is, firstly, it's only the providers who accept publicly funded children who participate in the QRIS system. So we have this whole segment of the market, of the childcare market, providers that only accept private pay children, by and large, do not participate in the QRIS system, step up to quality in Ohio. And so is there a way we can kind of get those providers participating and also incentivize providers to improve their quality through another tool? So there are programs states are using, including here in Ohio, where essentially offering grants to providers to kind of engage in the activities they need to move up a quality level. I think that is a great idea, and I think that's something we should pursue. But I think there's kind of an important distinction when we're thinking about a provider's decision about whether to do what they need to do to move up a quality level. There's the set of things they need to invest in right now, kind of a one-time investment that they need to do in order to achieve quality, which is going to include all the administrative tasks they need to do, like filling out all the paperwork and making time for someone to come and observe their classroom, et cetera. And then also anything they need to do, kind of one-off purchases. So for example, buying a new curriculum, these are going to be kind of the one-time upfront costs that they need to do. But then a lot of the requirements, especially when we're looking at the higher star levels, to meet those requirements, it's not just a one-time cost. There's a long-term, there's kind of like an operational ongoing cost. So for example, I need to recruit a set of teachers that have certain experience levels. So in Ohio, we no longer have a credential requirement, but a lot of states do have a credential requirement. Some fraction of your teachers need to have an associate degree or something like that. So to recruit a set of teachers that is kind of more qualified, we need to pay them more, not just once up front, but every month. And so there's a bit of a mismatch that happens when we're thinking about the types of programs that states are currently using, which are these kind of one-time grants to incentivize providers to move up a quality level. Those grants can cover those upfront costs and cover a lot of the initial administrative burden, which I think is wonderful, but I think there's going to be a remaining problem that unless it makes sense for the provider's business model, most providers are trying to operate as a small business. They're not operating as a nonprofit. They're not kind of a mission-based provider. They're a small business. And so if we can't make the numbers work for them on an ongoing basis, then those grants are not going to achieve the goal that we hope they are. So I do think that there is a way, and states should be thinking about this, of how can we get more providers in the system, and how can we kind of incentivize them to improve quality, not just through that publicly funded childcare mechanism, but I think we need to do so in a way that makes sense for the long term, and providing one-time grants is not always going to achieve that. Great question, though. Thanks. Yeah.
I'm Charlie Porter. I'm from UNICEF USA. And you had mentioned earlier on, and you kind of touched on it now, that we have all this data and legislation needs to catch up, right? So how do we actually incentivize politicians to make long-term decisions when their best interest isn't short-term solutions?
Great question. I wish I knew the answer to that one. I think maybe I'll punt that one to Jamie, because I think that's really Jamie's
I'll take a
bread
stab.
and butter.
And if our advocacy folks in the room also want to add to it, that's great. I love that you use the word incentive, because I think that's where it is. I think until folks are forced to do things, they don't. And so when you look at the incentives facing most policymakers and politicians, they aren't aligned to do the moral high ground. Like, I often hear people talking about doing what's right for kids and families. If that moral argument would work, we'd have done it by now. We see other countries do it. We've not been able to do it for a variety of cultural, racial, lots of historical reasons, I would argue. So I think it's about building coalitions and improving advocacy and lobbying. I know that's a cynical way to look at it, but I know a lot of groups have formed and are really trying to push. And you saw last year, folks, they organized a walkout. And so things like that where we disrupt people's bottom line by walking out because we don't have care and just bringing things to a grinding halt could be one way of going about it. Troy or Nathan, I don't want to put you on the spot, but do you have thoughts about what to do when, you know, we've got the data, but folks aren't acting on it yet? Thank you.
Yeah. I think another, just to add on, cool model, we're working with Colorado, and they, out of University of Denver, created a center called the Colorado Lab, which is essentially like a research clearinghouse. And they work closely with state government. We have something similar with the OERC here, where there's like a connection between the university and the state government. I think the thing they have going on that I think is pretty cool is that there is an advocacy angle to their work. So they're kind of working as the liaison between state government and researchers, but then they're also very, very interested in how the research is being kind of communicated and strategic about how the research is being communicated as well. And I think that's something that we could benefit from here in Ohio, to not just kind of be doing these research studies in isolation, but have almost a centralized kind of advocacy angle to the work we're doing at places like Ohio State and other kind of large universities in the state where a lot of these studies are happening. But you know, you saw, I'm a researcher, I punted on that question. It's not, and I think that's how a lot of researchers feel, because, you know, to some extent there is a conflict of interest between research and advocacy. It's a very interesting one, I think, in the sense that as a researcher, I'm not supposed to know what I'm going to find when I start a study, and I'm not supposed to be kind of trying to find a particular result. But as an advocate, I know exactly what I want to find. And, you know, I can't separate those parts of myself, but I do think there is kind of, you know, there's a way we could help researchers bridge that gap in a little bit more of a strategic way.
Great. Let's do one more, because I know we got a late start.
So the policy in Canada,
Mm-hmm.
would you be supportive of those African stations that could be applied here? I'm thinking of the idea of all barriers that would happen here.
Yeah.
If we live in a perfect world,
Absolutely, and I forgot to talk about the Canada Child Benefit. So Canada Child Benefit is tax credit for families with kids. It is essentially the model for what we had when we had the expanded child tax credit for those 2 years. So it's a much higher credit. It is available to everybody. The full value of the credit is available to everybody, no matter how little you earn. Right now, the child tax credit we have in the United States, the lowest income families do not get the full amount because of the non-refundability of the credit. And so one of the big, I think, important changes that happened when we had that temporary expansion was that we essentially upped the amount we were transferring to the lowest income families. So yes, I think the policies that they are implementing in Canada right now, I think those are exactly what we should be kind of modeling. And I think the child tax credit here in the US, that is one that I do think is politically feasible, because everyone got a little taste of it, and I think everyone liked it, whether they were a Republican or a Democrat. Every family with children was like, oh, this is pretty nice. And I think, one funny thing is that when we pass a policy and families get the benefit, no matter what their stated political preferences are, they do not want to give up that benefit, right? So with Medicaid expansion, even people who were kind of previously opposed to it, once they got it in their state, they were like, no, we want this. This is good. This is good stuff. So I think that is one where there is a lot of potential for us to pass it. Federal $10 a day daycare. I think that is a good option given the current, what we have now. I think that if we had a perfect world, early child education should be in the public education system. It should not be a separate system with private providers. It does not make sense, and it is not sustainable. So, it's difficult to regulate. It's difficult to fund. In a perfect world, I wish that we all kind of went to public school starting at age 2 or 3 or whatever we wanted to do, right? We had a nice long parental leave until the kid's 18 months, and then we throw them in the public school after that. That would be my preference if I could, hit a button and make everything over again. But I think given the system we have, I think a subsidy that works within the system of private providers, but a widely available subsidy to kind of minimize this segregation that we are creating in our system, I think that is kind of a more feasible policy for here.
All right, thank you so much. Please join me in thanking Dr. Jones for sharing with us today.
Thank you. Thank you all for coming. Appreciate it. And I'm happy to stick around if anyone has any questions.
I'm supposed to tell you about the survey here. So we're also going to be emailing a link so you can take the QR here or just look out for your email. It's short and anonymous. We do read them all, and we use some of that feedback to make decisions about our future event series. So please do weigh in. Let us know if you have other thoughts or feedback or questions. Thank you.